Hi everyone, I'm Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about fibroids and how fibroids impact fertility. What are symptoms of fibroids and how do we go about treating them? So let's talk about that today. What are fibroids? Fibroids are benign overgrowths of the smooth muscle in the uterus. They are not cancerous. They are fairly common. They happen in about 20% of reproductive age women, and they're more common in African American women. The cause is not really known, but there may be a component of genetic factors, environmental factors, and hormonal factors that contribute to them being there. We generally will categorize fibroids into different categories based on their location, and there are three main ones. So the first one is submucosal, meaning it's impacting the inside of the cavity. Then there is intramural, which is in the muscle of the uterus, and then there's subserosal, which are on the outside of the uterus. So depending on what type of fibroid it is, will dictate the treatment that we'll recommend. Not all women with fibroids have symptoms, but if patients are symptomatic from fibroids, some of the common symptoms are pain with periods, pain with intercourse, heavy bleeding with your period, bleeding in between periods, anemia, sometimes requiring a blood transfusion, the sensation of needing to urinate often if fibroids are pushing up on the bladder, and sometimes patients will present with infertility or recurrent pregnancy loss because fibroids can be associated with this outcome also. There are a few different ways that fibroids can impact fertility. If the fibroid is near the cervix, this can interfere with the sperm's ability to get into the uterus. If the fibroid is near the fallopian tube, this could block the fallopian tube and not allow the egg and sperm to meet. If the fibroids are more in the uterine body, then it could affect movement of the sperm, movement of the embryo, or implantation. So there are a few different ways that fibroids could potentially impact fertility. So let's talk about the different fibroid categories and which ones can impact fertility. So the first was the submucosal fibroids. These are fibroids that are inside the cavity and definitely can have an impact on fertility. So we will recommend removing these type of fibroids. Intramural fibroids, it kind of depends. If they are small, then they are most likely not contributing to infertility. But if they are large and if they are shifting the cavity, for example, more than 4 centimeters in diameter, and they're shifting the cavity on imaging, then we will most likely recommend to remove these type of fibroids. The last category is subserosal fibroids, and these are fibroids on the outside of the uterus. So these, generally speaking, do not impact fertility, and we usually do not recommend removing fibroids in that category. Fibroids that impact fertility can only be treated surgically. The reason is that medical options, for example, birth control pills, these work by suppressing a woman's cycle and suppressing ovulation. And these things are counterintuitive for women trying to conceive. So that's why medical options usually don't make sense in women who have fibroids that are impacting fertility. Now, when it comes to surgery, going back to the categories, there are different surgery options. So for the submucosal fibroid, that's usually treated with a hysteroscopy, which is a telescope instrument that will go in the uterus and remove the fibroid that way. Now, depending on the size of the fibroid and if there are many of them, we may not be able to do it with one procedure and may require a second hysteroscopy to remove the fibroid in total. The intramural fibroids, there are a few options on how to perform the surgery. It just depends on the woman's history, her surgical history, how big the fibroid is, the location. So depending on these factors, sometimes we can treat it with a robotic laparoscopic procedure, or sometimes we'll have to do an open procedure like a C-section cut. And again, the subserosal fibroids, most of the time we do not recommend removing these because they should not have an impact on fertility. Whether or not you need treatment for your fibroids, it's a really case-by-case individual decision because there's so much variability among women in terms of their history, the size of the fibroid, and location. So if you want to know if surgery is needed for you and your fibroids because you're trying to conceive, please see a fertility physician. They can evaluate you and give you what recommendations they would have. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.